Hello, my name is Sarah Wiseman. This is my cardiac assessment. All right, so I need you to look this way for me. Okay, look this way. I didn't notice any jugular vein distension or anything like that upon inspection. Next, it would be to actually check for the PMI. I'm not going to have my patient undress for this, but normally we would either have the patient with the head of the bed elevated at 45 degrees and use tangential lighting to highlight any type of subtle pulsations, or you could have them laying in the left decubitus position. I'm not trained or experienced enough to do that, but that's the process of what you do. The next thing I'm gonna do is I'm gonna check for his JVP. So can you turn your chair just a little bit and try to lean back a little bit more? There we go. So it was 4 centimeters on the right. And 4 centimeters on the left. Anything from 3 to 4 is within normal limits. All right. Carotid. Okay, his carotid artery is 2 plus. Consistent rate. Didn't notice any thrills or anything like that. Now I'm going to palpate his point of maximum impulse. So you go down between the 4th and 5th intercostal space. And it's like a small localized tapping. It's about 2 to 3 centimeters, so about the size of a penny or a dime. The next thing I want to do is I'm going to find his aortic, and that is 2nd intercostal space. And it's just a very, very light, subtle tapping. I'm going to listen to your carotid. Just hold your breath for me. Okay, breathe out. Take a deep breath in and hold it. Okay, so when I auscultated his carotid artery, I did not hear any type of bruit. Now I want to start off at the aortic, pulmonic, Erb's point, tricuspid, and mitral. I heard lub-dub sounds when I listened to his carotid. Let's see. I didn't hear any extra sounds or murmurs. I'm going to turn it to the bell. See if I can listen to the apex of his heart. Okay. All right. Didn't hear any extra beats or murmurs with that. Now, I can't have the patient lay in a left decubitus position right now to see if I could auscultate his apex, just because I can't bend over. But if you want to have the patient, if you can't auscultate it, then you put them in the left decubitus position so it brings that heart closer to the chest wall. All right, now I need you to lean forward, and I need you to exhale every time I move my stethoscope, okay? Mm-hmm. Okay, I didn't hear any murmurs or anything like that every time he would breathe. Now I'm just going to listen to your heart, and all I need you to do is breathe normally. Oh, wait, I need to check the rhythm. Let me time myself. I'm just going to use the clock. Heart rate is 78. Consistent rhythm. Didn't hear any extra sounds or anything like that. And S1, S2 was noted. No S3, no gallops, no murmurs.